Thank you for being here. We are here because we want to save lives. Tobacco is the leading cause of preventable death in the United States, and for all the progress that we've made over the years, thanks to many of the organizations represented in this room, we still have a lot of work to do. This cannot wait because the numbers of young people who are starting to use tobacco products is growing fast. According to the CDC, between 2017 and 2018, the number of middle school and high school students who started using tobacco increased by 36% in just 1 year. And that's largely because of vaping. And that's why we introduced the Tobacco to 21 Act, because one of the best ways we can stop tobacco use is by increasing the legal smoking age. According to the National Academy of Medicine, raising the legal age to 21 would save more than 220,000 lives. Our bill is clean, it is simple, it is free of loopholes, and it is bipartisan. And as you can see, we've got a good group of members behind this effort. I know that this legislation will work because my home state pioneered it. In 2016, Hawaii became the first state to ban tobacco sales to anyone under 21, and since then, 11 other states have joined. Now, Tobacco to 21 is not the only thing to be done. On the regulatory side, the FDA still needs to take a stronger approach to regulatory actions and its reviews of new tobacco products. And there are other steps that Congress should take, like banning flavored tobacco products and putting more money into prevention and cessation programs. But Tobacco 21 is the first step that we can take today. It will boost public health, save taxpayers' money, and most importantly, keep our young people from getting hooked. So let's get this done. Senator Young.
Well, thank you, Senator Schatz, for your leadership on this. I'm proud to be here to help introduce the Tobacco to 21 Act and to see this legislation move forward. As the national debate continues over what we should do with respect to healthcare policy and bringing down healthcare costs, extending lives, improving lives, there's one thing we ought to be able to agree on, because public health experts emphasize this. The most achievable, the most consequential, and the most impactful act that we can take here at the federal level to bring down healthcare costs and improve health outcomes is to pass this bill, is to increase the tobacco purchase age to 21. This is especially important in my home state of Indiana, where tobacco use is the single most preventable cause of death and disease. In fact, the state of Indiana ranks 45th in the country in terms of tobacco usage. I know we can improve on that. I know this is important to Hoosiers in my state. In fact, more than 1 in 5 Hoosiers uses a tobacco product. Nationally, 95% of Americans begin using tobacco before age 21. Think about that. If we can raise the age of purchase, we can significantly reduce the number of people who begin using this product, and we can avoid the deaths and adverse health outcomes associated with this. Moreover, the cost on society for healthcare associated with tobacco use is roughly $300 billion per year. $300 billion per year. This is a bipartisan measure. We have an opportunity to significantly reduce public expenditures in this area. It's important we act now. With the advent of e-cigarettes and the uptake of vaping, especially among young Americans, it's essential we act now. In fact, during a 1-year period from 2017 to 2018, we saw an increase in utilization of these products by 78% among high school students, and by also alarming numbers at the middle school level. So I'm proud to be here again with my colleagues, and with that, I will turn it over to someone who's led in this area for a number of years, my neighbor, Senator Durbin.
Thanks, Todd. I was just thinking, when I introduced the bill to ban smoking on airplanes, my Republican co-sponsor was Congressman Young, Bill Young of Florida. So it's great to be with my Republican colleagues, and to start off by thanking the leadership of Brian Schatz to bring us together in this common effort. It was over 25 years ago when we banned smoking on airplanes. It was kind of a breakthrough moment when people started taking seriously the notion that secondhand smoke was dangerous and that truly we could do something, despite the strength of the tobacco lobby, to make America a safer place, to increase the public health awareness and the public health outcomes in our country. It's been a long journey. This is a good part of that journey, an important milestone in that journey, raising the age of purchase for both tobacco products and for e-vaping and similar products to the age of 21. Let me start with the good news. Cigarette smoking among kids has dropped 28%, from 28% in the year 2000 to less than 8% in 2018. That's still 8% too much, but it's a great success story and one that couldn't have happened without a coordinated effort by the states, the federal government, courts, and the public health community. We know the best way to reduce smoking rates are through a comprehensive strategy that reduces access and appeal. That's why we banned flavors in cigarettes, raised taxes on cigarettes, increased non-smoking zones and campuses. Raising the tobacco age to 21, as a dozen states, including Illinois, recently did, will make it harder for teens to get their hands on these deadly products. It's long past time that this be done at the national level. It has reached such a level of support that we see full-page ads every day. This morning's Washington Post with a full-page ad calling for stopping underage vaping starts with raising the age to purchase tobacco nationwide. Paid for by Altria, a tobacco company, Philip Morris, Juul, and others. The point is that it isn't just a matter of raising the age to 21. Senator Schatz and Senator Young were correct. We have to make sure that we take a look at another phenomenon that's taking place out there that is really alarming. While we have good news in the number of young people using tobacco, while cigarette smoking has declined, e-cigarette use among children has been increasing at alarming rates, largely because of kid-friendly flavoring. In 2018, e-cigarette use increased by 80% among high school students, 50% among middle schoolers across America. Go to any high school or middle school in any town, in any state, and ask them if vaping's a problem. And they'll tell you. The kids are using what looks like something you plug into a computer as their tool or mechanism or instrument for vaping. More than 3.5 million children are currently vaping, many of them with the immensely popular Juul e-cigarette. We know kids are trying e-cigarettes because of the flavors. 81% of them tell us. The big tobacco companies and vape companies like Juul and Altria, who've teamed up, say that kid-friendly flavors are meant to help adults to quit smoking. Let me read some of those flavors to you so you can be the judge as to whether this is going to have an impact on adults. The flavors include Fruit Medley, Gummy Bears, Cotton Candy, Fruity Hoops, Marshmallow, Mom's Custard, and S'mores Galore. Does that sound like something that's designed for children or adults? I think it's clear. Let's make sure that we do this and raise the age for tobacco and e-vaping to 21, but let's not stop there. Let's work with the states to make sure that we stop this insidious march of e-vaping and e-cigarettes and the harm that it's causing to kids across the nation. My friend, Senator Mitt Romney. Trade places with you.
Thank you, Senator Durbin. It's an honor to be here with Senator Schatz and Senator Young and Senator Durbin to join in this bipartisan effort because of what we know. What we know is that tobacco damages the human body. What we know is that tobacco kills people. We know that people that are hooked on tobacco end up taking home less pay every week because of the cost of tobacco. We also know that tobacco use is costing our nation billions upon billions of dollars. A loss of life, a loss of funds. It makes all the sense in the world to say, let's try and help young people from getting hooked on this terrible product. Unfortunately, we also know that young people tend to have, in some cases, not a lot of perspective about the choices they're making and perhaps not enough experience to make the judgment that's most wise for their long-term experience. And for that reason, it makes all the sense in the world to make it illegal for young people to purchase these products so that we can help them during a time when their judgment is not as clear as it might be. Older people typically have figured out that tobacco products make no sense at all. In my home state, the legislature figured this out, was one of the first states in the nation to say, we're going to raise the smoking age to 21, and they did so because they saw what was happening with vaping. Vaping has doubled in young people in my state. This is the same trend we're seeing across the country. This is one step we can take. There are more steps that we need to take, but this is a critical step. It will save lives. It will improve the health of our citizens. It will also save billions of dollars. Let's get this done. Let's move it as quickly as possible through the Senate and the House and get it signed by the President.
Thank you, Senators, for inviting me to speak today. My name is Queen Cornish. I'm a senior at Mount Pleasant High School, and I'm also the state chair of Kick Butts Generation, which is a tobacco nicotine prevention program among Delaware youth. 480,000 Americans each year die from smoking-related illnesses. People including Senator Schatz, Durbin, Romney, and Young, the state of Delaware, Deb and Matt, and many energized youth across the country are trying to lower and eradicate these numbers. Recently, KBG members had the opportunity to witness history as the Tobacco 21 bill was signed into law at our legislative hall in Delaware. After the bill was signed, tears welled up in my eyes as I realized that we had just saved thousands of lives. If Congress passes S 1258 into law, that number will go up to hundreds of thousands of lives, thus emphasizing the importance of this bill becoming a law. I support the idea of the Tobacco 21 bill because nicotine consumption is not just a Black or LGBTQ problem, it's an American problem. My generation is experiencing this e-cigarette epidemic, but Congress has the power to protect us from tobacco and nicotine products. The Tobacco 21 bill is an important step forward in the right direction. Congress has an opportunity right here, right now, to help in this epidemic. Thank you.
Very good. Very good.
Thank you. My name is Matthew Myers. I'm the president of the Campaign for Tobacco-Free Kids. And I want to thank Senator Schatz, Senator Romney, Senator Durbin, Senator Young for the bipartisan leadership that ought to be able to get this job done. What we know is that raising the age to sale to 21 is an important component of a comprehensive plan to reverse the epidemic of e-cigarette and cigarette use in this nation and to put our nation on a long-term trend to solving this crisis. We urge Congress to pass this strong legislation and to reject any effort whatsoever by special interests to try to either water down to this law or to add provisions to this law that would provide more protection for the tobacco companies than for our nation's youth. As you know, the tobacco industry has sought to argue that if a Tobacco 21 bill is enacted, no further action is needed. As you've heard from each of the co-sponsors here today, this is an important step, but it isn't the only step. We have to take strong, decisive action to eliminate the flavors and the products that are creating an epidemic among our nation's youth. This is a start, but not a finish to that. We look forward to working with all of the sponsors to this bill to help turn this bill into the law of the nation, and then moving on to ensuring that we take the other steps needed to truly reverse the epidemic among our nation's youth. What happens in the next 12 to 24 months with regard to the epidemic of e-cigarette use among our children's youth is something that will impact this nation for decades to come. Either we act now or we pay for years and years. Thank you.
Senators Schatz, Young, Durbin, and Romney, thank you for inviting me to join you today. I am Deb Brown, the Chief Mission for the American Lung Association, and it is my pleasure to stand before you today and extend the full support of the American Lung Association for this bipartisan bicameral Tobacco 21 Act. The American Lung Association is the leading organization working to save lives by improving lung health and preventing lung disease. The Lung Association is committed to eliminating tobacco use and tobacco-related diseases, and we recognize the Tobacco to 21 legislation is an important policy on our way to achieve that goal. Tobacco use remains the #1 cause of preventable death, and addressing tobacco use and facing down the tobacco industry requires bold leadership. The tobacco companies are targeting our kids with candy-flavored e-cigarettes. Mint and menthol remain the most popular of all flavors for kids. This must be stopped. Yesterday, I had the honor to spend the day with over 650 youth advocates in Harrisburg, Pennsylvania, who were there to educate their state lawmakers about how raising the age of sale for tobacco products to 21 will save lives. There is tremendous support for this policy across our country. More than 55 years ago, the U.S. Surgeon General sounded the alarm with the landmark 1964 report on smoking and health. This June will mark the 10th anniversary of the passage of the Tobacco Control Act, which gave the Food and Drug Administration authority over all tobacco products. We look forward to Tobacco to 21 joining these historic milestones in the nation's fight against tobacco. The Lung Association urges Congress to pass S 1258 and to fight back against the inevitable efforts that the tobacco industry will use to weaken the strong legislation and undermine FDA's authority to protect our nation's public health from all tobacco products. Thank you again for the opportunity to be here with you today, and the American Lung Association looks forward to supporting your efforts and ensuring this bill will become law. Thank you. Senator Schatz.